if there's anything confidential you don't want to share with the group, make sure you let us know, raise your hand, let Lynn or Tim or myself know, and we'll stop it for that time period. Your questions are really important. Not only does it help the group that's here, but it certainly helps the people that may watch this video at another time that could very easily have the same question. So be bold in your questions. This is a safe room. Whatever Dr. Cramer and Lynn and Tim definitely want to do their best, and each of us can also provide our own insight. If you have any comments to make, you can send it. If you have a question, you can send it to me by chat. You can raise your hand literally, or you can raise your hand with the reactions at the bottom. So with that, Tim, if you want to introduce Dr. Cramer.
Okay, I've got something on the screen. This meeting is being recorded. Do I get rid of that?
Well, you can't get rid of that. Well, you may be able to click that away. I can't see your screen.
It says got it or leave meeting.
Got it. Look,
got it.
They've really changed the software on this.
Yeah. We're fortunate again to have Dr. Cramer with us. I think I put in the note, hi, Dr. Cramer, that she's the owner of Precise Chiropractic in Troy, Michigan. Hopefully I said that right, Dr. Cramer. Yeah. And we have an opportunity again to hear a natural approach to TN through NUCCA care. I've had a couple of people call me today and say they weren't going to be able to make the meeting, but they were looking forward to seeing the video because they'd never heard of that procedure before. So it doesn't surprise me, I guess. The first time I heard it, I believe Lynn was at one of the TNA conferences. A lady was there to make a presentation. That goes back 10 years. And I think you've talked to our group 2 or 3 times, Dr. Cramer.
Well, actually, I was the one that spoke at the group 10 years ago to the national conference. Yeah, that was me 10 years ago.
Thank you for the memory.
It's okay. It technically, it was in 2008 is when I spoke with the national association. Yeah, 2008, 2009, somewhere in there, when they had it down in Dearborn, and we had like over 300 people in the room, and I got to bring this to the group. And because of that conference, I've had more trigeminal neuralgia cases in a chiropractic office than I think than anywhere in Michigan because of that connection.
Great.
That's great.
And in fact, I think it was even before 2008 in Orlando. They had a lady, she was in a wheelchair, and she made a presentation on NUCCA. I don't know if that rings any bells, whether you've run into a lady in a wheelchair that does the same thing.
You know, not off the top of my head, but I know that the man that wrote the What Time Tuesday book, I don't know if his wife was in the wheelchair or not, but I think they might have been from Florida.
Maybe that was it. Yeah.
Yeah.
It could have been it. Yeah. Anyway, without going on, I think I put your number and your how to contact you for our local people in the note as well, so I won't go back over that.
So, I'll post it in the chat box.
Okay, thanks. Go ahead, Dr. Cramer. We look forward. You provide one of the greatest schematics and other things in your presentation when we met at Beaumont, I can remember. So I don't plan on the same tonight, but you really make it understandable.
Absolutely. Well, I'm just going to share a couple things as I get started. I'm going to share that with you guys as well. Thanks for the introduction. And I'm going to share my screen. And as I share my screen tonight, I don't know if you guys can see me as well. Can you guys see me and the screen?
Yep.
Yes. Yep. Okay, we're good to go on this. Okay. So we're obviously talking about trigeminal neuralgia and the NUCCA, which is the type of chiropractic that I do. And it's an acronym. It stands for the National Upper Cervical Chiropractic Association. And it's approach to TN relief. Okay. Let me see if I can advance this. Oh, good. So just a little bit about myself. So that's myself. I graduated from Palmer College of Chiropractic in Davenport, Iowa in 2005. So that's like 17, 18 years ago now. And I am an upper cervical chiropractor. My practice is in Troy, and my life has been changed through this type of work. That's actually how I got into NUCCA. And I'm going to make my connection to TN in just a little bit, but I was in a really, really bad accident when I was 16. And after this bad car accident, I developed migraine headaches, numbness in both of my hands. I vomited about daily for 3 years straight and had horrible back pain. And now this isn't trigeminal neuralgia pain, but this was serious pain for a 16-year-old girl for 3 years. And every time I went to my doctor, who I had a great relationship with, I got lots and lots of pills and drugs, and it covered up what was going on, and it didn't really make me feel any better. And then a friend of mine told me about regular chiropractic, and I was like, okay, I thought that was just for low back pain, and I had some of these other things going on. And I went in and they explained to me that if my brain and my body aren't connected, my nerves aren't going to work right, and my body's going to malfunction, and I can have pain and dysfunction in my body. And I go, oh my gosh, that makes so much sense. Why didn't anybody tell me this? As I was getting doped up, and I was withdrawing from society because I was on all these medications. It was just a very dark time in my life. And then I through a friend, I heard about NUCCA, which I called NUCCA at the time. And I went to the NUCCA chiropractor, the NUCCA chiropractor, and it was literally the answer to my prayers, and the sea parted in my world, and I got better. And from there, I actually switched my career paths and I became a chiropractor. And like I said, I've been practicing since 2005. So that's just a little bit of like my why, how I got into this work. And I have a true passion to help people that are suffering, because I've suffered myself, and the devastations of that are just horrific. And then through that, I had met a man named James Tomasi, and James Tomasi wrote this book called What Time Tuesday. Has anybody read this book? I see some faces. I've got one person. I can't see you all right now. Let's see, I'm scrolling through. Maybe, well, if you haven't read this book, I would highly recommend reading this book. It's about a trigeminal neuralgia success story with upper cervical care, the type of care we do in our office. And the book is called What Time Tuesday, because he didn't know what time on Tuesday. He wanted to take his own life on Tuesday because the pain was so difficult. He just didn't know what time he was going to do it. And it's a really amazing book, and very uplifting, even though it sounds awful, of how his life was changed. So I met him, and I was so inspired, and I was like, there's people like this in the world. And then I started learning about it, and then I got connected with Tim and Lynn many years ago. I actually spoke with the Detroit group before I spoke at the international conference, and that's how you guys connected me, is because I came in, and I think I spoke to you guys at Beaumont, and they needed a speaker at the international, and then I came in, and then we've been kind of hanging out ever since. So I think that's the gist of it back in like 2008-ish. So that's a little bit about that. So in these What Time Tuesday books, I know Tim and Lynn have copies of these if anybody wanted them. We also have them at my office, that if you're in the area, you're more than welcome to pick up a copy of this. Okay. So let's see here. So that's just a little bit about that. So NUCCA and a natural approach. So let's first talk about trigeminal neuralgia. Okay. So there's a book called Guith and Hall, and it's a medical textbook. Okay. And there's literally one page of the most common used medical textbook on the planet for the United States, called Guith and Hall. And there's not even like a full, like one page about trigeminal neuralgia. So this is literally the definition of it. And I don't even know if I'm going to read it all, because my screen's a little cut off, but it says, lancinating pain occasionally occurring in some people. I can't read it. Does anybody else have it where they can see? Let's see here. Oh, I got it now. I moved you guys away. Occurs in some people over one side of the face in the sensory distribution area of the 5th or 9th nerves. The pain of tic douloureux can usually be blocked by surgical cutting of the peripheral nerve from the hypersensitive area. Furthermore, sometimes the operation is unsuccessful, indicating that the lesion that caused the pain is in the sensory nucleus of the brainstem and not the peripheral nerves. That actually speaks a lot about what we do with NUCCA, actually, and that will make sense in just a little bit. Sorry, guys, I'm having a tiny bit of technical stuff to move my screen forward now. Okay, so that's what we talked about. It was only 1/3 of a page was devoted to it. So there's not a lot known. There's not a lot dedicated to this condition, is what I'm trying to say. So let's talk about the origin of the brainstem, because this is where the trigeminal nerve starts. So this is a skull. Taken out of that, that's where the brainstem is. If you put your you got your ears, you put your fingers up there, right in the center, that's your brainstem. Okay. And the origin of this nerve, it shows you as a close-up, is that big yellow area where it says the trigeminal nerve and the ganglion. Okay. So you can see this whole brown area is the brainstem, and there's lots of things that come out of the level of the brainstem, and one is the trigeminal nerve. Okay. And then the trigeminal nerve, each side of the face, it has 3 branches: ophthalmic, maxillary, mandibular. So V1, V2, V3. It actually comes through the top of your skull. And if you look to the right of the screen here, you can see the maxillary and mandibular, and they come through these holes, okay, at the top of the skull. So the origin is where it starts. The exit points are where the nerves exit the skull and enter the face. And the distribution are the pathways where the nerves go into the branches. So this shows you the distribution of the nerve. Because I have been working with patients for, quite some time now. Gosh, I have to think about that. So I had my first trigeminal case in 2006. And, each case is so unique and different where, we can have it right above your lip or on the side of your nose or right back here in your jaw, or maybe right up here on your eye. And it can be with different areas of the branch. So we've got, the ophthalmic, ophthalmic, maxillary, mandibular. And then of course it can be affecting multiple parts of it at the same time. And then one side or both, right? So we have atypical and typical, right? And then it shows you here that the nerves of the first and the second branch, and you can see in this picture how it can go into, like I just said, it can go into the top of the eye. It can go behind the eye. It can go right into the tip of the nose, on the side of the nose, on this part of the face. So these schematics can help understand, like, oh, that's where that pain is. This is what it looks like inside. That's pretty much the point of sharing this with you. But the key too is you're going to see how this comes back to the brainstem and how it connects to the spine, and how actually the spine could be the answer for a number of people. Okay. And this is the third group that goes into the face, and it comes through here and it works its way. You can have it here. You can have it underneath, even further. So lots of little areas of the nerve. So what's the problem? So most theories of causes of trigeminal neuralgia focus on irritation of the nerve, right? Nerves are delicate. It doesn't take much pressure or friction to damage them. Okay. So Dr. Sue came up with this amazing study. It was back in the University of Colorado in 1975, where he did the sciatic nerve of a rabbit attached to a light bulb. The weight of a feather, or 10 millimeters of mercury, dropped nerve conduction and brightness by the bulb by 50%. And removal of that dime restored the normal nerve flow. So if anything gets disrupted in the face or in the connection between that and the face, can cause nerve interference. And that's, the primary theory of trigeminal neuralgia. And when damaged, the nerves transmit messages of pain back to the brain, where the messages register and we feel the effects. So let's talk about a nerve for a second. So I love this example. I use this quite often in my practice. Any nerve in the body is composed of many thousands of nerve fibers. So this picture is a picture of a PVC tubing, okay? And think about the tubing being filled with straws, okay? And I want you to think of the straws as red, white, and blue, okay? Because inside of a nerve fiber, there's 3 types of fibers. There's motor, which controls your muscles. There's sensory, which controls the pain or what you feel. And then there's autonomic, that controls the organs, okay? So in every single nerve, there's these components of them. And the arrangement of these red, white, and blue straws is random to each individual and each nerve. So some people have, I'm going to code this. I don't know if my next slide has this or not. Yes, it does. So, but I'll come back to it because I'm going to explain it. I think you guys will understand this better. But each inside the PVC pipe with the red, white, and blue, let's pretend the red is the sensory fibers. Those are the part you feel. Okay. And the blue are the motor, what make your muscles move. And the white is the autonomic, which makes your heart go and your breathing happen and you don't have to think about it. So those arrangements are random, but some people have all their sensory fibers, all their red ones on the outside. So they can just have an itty bitty bit of pressure on any nerve in the body. We're talking about the sciatica nerve to the occipital nerve, to the carpal tunnel nerve, to wherever nerve you want to talk about. And they're going to feel that pain. And someone else can have that same nerve compression and not feel it at all because all their sensory fibers are in the inside of their nerve, because it's not connecting or hitting that nerve quite as much. Does that make sense? Can I get a couple shakes on that? Okay, that's making sense. So I went over that. So therefore, pressure on the exact same nerve can have differing symptoms. That's why pain pattern is different, even though the same nerve is affected. So your trigeminal nerve could be affected, but again, you could have different sensory components of what parts you feel as well. So that's true of the trigeminal nerve or the sixth cranial nerve or any other nerve in the body. So now we understand why there's pain, what can be done, right? So the number one thing that I think all of you, or if you're here for a loved one or you're self-facing, is going to be medication, right? You guys are a lot of Tegretol is a really popular one for trigeminal neuralgia, but painkillers to mask the messages from the damaged nerve. And many types of medications are currently used were developed to combat epileptic seizures. Another option is microvascular decompression, right? So you take the pressure off the nerve, portion of the skull is removed, it's wrapped in Teflon, you replace the removed section of the bone with the wire mesh screen and preserve the skull's integrity. So that's another option for people with trigeminal. So we've got medication, microvascular decompression. Gamma knife's another one. And I've seen patients, with all three of these for sure. Gamma knife projects 201 fine beams of gamma rays to generate the radioactive cobalt through the skull and the brain. And it goes into the dose of radiation along with one beam is too small to do any harm by itself. But when you point all 201 beams intersect at a very high dose of radiation can be given, and no radiation to the surrounding tissue to affect that area as well. So is there another way? So that's something that there is. So the principles of upper cervical chiropractic and NUCCA. So the body is actually self-healing and self-regulating. This is really important to understand. As long as the nerve is not severed, it can regenerate at any age. It doesn't matter if you're 100 or if you're, three days old. A nerve can regenerate, okay, as long as it hasn't been cut. Okay, so that's super important to understand. Your healing rates change the older we get, or how long the problems is there, but it still has the ability to heal. So that's super important to understand. The brain controls all functions of the cells at all times, and nerves transmit these signals. Okay, so in this picture here, it says this picture right here is the brain, and this is the spine right here. And we're talking about this thing called an atlas. Okay, so when the atlas or the top bone of the neck misaligns, the transmissions of the signals can be disrupted. So it's really important to understand, because at the top of your neck where your atlas is, it's actually a very unique area. It's actually a free floating bone, meaning there's no osseous connections between that area of your spine than any other area in your spine. It's attached by ligaments and muscles and tendons and all the things like that. There's no bone-on-bone connection. The atlas was named after the mythological god of the man that held up the world. The atlas folds up the skull. Okay, so it's a really important area, and it's at the level of the brainstem. Okay, your brainstems where over 3 trillion things occur at. Okay, brainstem's really important. We just went back to the picture of where the trigeminal neuralgia nerve generates from, right? It's called the brainstem, and that's also where the atlas affects. Okay, so I want you to make that connection right now. Now, it's important because the atlas is the key to what's communicating through the rest of your body. Because if that area is not cleared, the rest of your body is not going to work 100% for you either. It's like having a kink in the water hose to the most important area of your body, your brain. Okay. So the next here is the principles of chiropractic continued. Over time, misalignments may decrease the body's ability to adapt, and this results in symptoms. Now, I've met so many different cases over the years, and you all have an own case, and some people can connect an event to their trigeminal neuralgia pain or problem, and some people can't. Okay, so I know there's both camps out there. Okay, and we've got I went to the dentist, I had this event occur, and after this dental issue, I started having trigeminal pain, or I was in an accident, or I woke up and I just all of a sudden had this pain randomly. Okay, so those are just some examples, and there's probably many more that we could use for that. But over time, if this misalignment occurs, and it can occur from accidents, injuries, traumas over the course of our lifetime, even I'll meet people that I'll wake up after a surgery with a new pain or problem because misalignments could have happened under anesthesia. I mean, different things like that can occur as well, because the body gets in funky positions when you're dead weight, right? So over time, the misalignments are going to decrease the body's ability to adapt to heal, and that can lead to pain and symptoms. So it could be the straw that broke this camel's back, like it was something that was brewing like a cavity in there, or it could have been an event that you can 100% correlate to the problem as well. And that can happen right away. Upper cervical chiropractors, we detect and correct these subluxations or these misalignments, and the nerve signals that get through to them properly to their intended targets, meaning we're going to get it restored so that the body can heal over time. That's what's wonderful about chiropractic. And there's 33 principles to this work that we do. And the 6th principle is the body will heal with some time. So what's really neat about doing NUCCA is we measure the body a lot. Okay, so the person that developed this procedure was an engineer that became a chiropractor. So it's literally like doing engineering of the spine. Okay, and what we look for is misalignment in this area. And I'm going to connect just in a little bit exactly how the trigeminal neuralgia nerve connects to the neck. Okay, because that's probably my favorite part of this whole presentation today. So that's coming up here in a minute. But what we do is we measure the body for body balance. We measure right to left, top to bottom. Is something off? And we actually do that. There's 2 options. The body's either going to be a state of alignment and balance, or they're going to be shifted, moved, and lost its balance. And we actually measure that we have these special devices called Spine Masters, where you stand on this machine and we measure hip height, hip rotation, neck off balance, and we even use some technology that measures nerve interference in our office so that we get a global picture of what's going on. And we do that before and after care in our office as well to make sure that everything is aligned properly. Okay, so this is an example. This is going to be what someone looks like before an adjustment. You can see that the head's tilted off here, the shoulders are crooked, the hips are crooked, and they might have a short leg. If you've ever been told you have a short leg and you haven't had a femur shattered or a hip shattered, you have some type of misalignment in your body that is correctable. Okay, as long as nothing's been shattered, then it's going to be more than likely correctable. Okay, it's under 0.4% of the population actually has a structural misalignment that is bone on bone. Everybody else is in this category. And this would be someone after an alignment, so everything's straight. So I actually do a show on WMUZ. It's for those of you that are local, it's on 103.5 FM Tuesday nights at 9 from 9 to 10 o'clock at night. I've been doing it for the last 11 years. And we give tips to find out if you're out of alignment. If you're not local, you can find us on iTunes on Your Weekly Checkup. And we actually had James Tomasi from What Time Tuesday on our program. You would have to go back to the archives and find it, but it's on iTunes. Your Weekly Checkup. And it'll be a picture of me and another doctor, Dr. Jonathan Lazar. And he joined us for our radio show, and we got to specially talk with him. And I believe I might have had you on, Tim. I'm not sure. I think we plugged you one time, weren't you?
Yeah, right.
Yeah. I said I would do this like a long time too. So thanks for helping me with the memory on that one too, Tim. Yeah. But what we do is we talk about, like, does your bra strap fall down if you're a woman? Do you notice that your pants are uneven? Do you notice that one leg is shorter than the other? Do you notice that in pictures your head's always tilted off to the side? Those are all signs that you could be misaligned, okay, if you're seeing some patterns. And those are just briefly. Are your glasses crooked? You know, when you get your hair cut and then you leave, is your hair crooked afterwards? Believe it or not, I've seen that a number of times as well. It's straight and then you kind of get back to yourself. So this is one of the ways that we are able to determine that. So when the atlas is returned back to its normal or aligned state, the paraspinal musculature of the body relaxes and the body goes back into the alignment. Hips will level out, the spine will return to a more aligned state, and the whole body alignment is restored. There's no guesswork. We do pre and post x-rays in our office that are all special laser aligned for optimal correction of the body. The x-rays we take are some of the highest quality x-rays possible. And then once the alignment has been achieved, the patient is checked to ensure that they hold the adjustments. So this is an example. This is kind of an older image, but this is an example of somebody on the left that is out of alignment. This is brainstem compression right here. When you see that red line is where the atlas is. This is the lower vertebrae, and this is the head. And right now, this person's very kinked, and this atlas is jammed way up, or you could say that's what's happening in this picture. It's jammed way up. So it's compressing on this left side of the brainstem right here. So when, oops, I missed it. And when we got them adjusted, it all balances out. We open everything up. The posture will return, but more importantly, the body will work and feel best. And that could be whether they have sciatica pain, trigeminal pain, like I said, carpal tunnel, to, neck discomfort or decreased range of motion in your neck. Because anytime we have decreased range of motion in our neck, that's not normal either. We're supposed to be able to move. Motion's life. So TN and upper cervical chiropractic. So there's 3 proposed ideas of why, when we do NUCCA adjustments in our office, like why does it help people? Okay. Well, there's three possible reasons why that could be happening. Because I'm going to be sharing some successes with you in a little bit here. One is the spinal trigeminal tract and lower cervical input, the blood pressure up, and the facial muscular tone. So this is a pathway of pain. This is the one that I was actually really excited to share with you guys. Okay. So you'd see down here, this is again where the trigeminal nerve is, right here. Okay. And this shows you that this is the brainstem on this schematic over here, this figure 33. And what we show here, and then this is called C1, C2, C3, C4. So C1 is right where that atlas is that we just talked about, that the mythological one, or the one that holds up the skull. So this is right here. So if this gets misaligned in this area and compresses off, let's say it compresses off on this side, because this is where the diagram is. This is where the trigeminal neuralgia nerve starts, okay? And then what happens is it has 2 branches of this, okay? And one of it is that it actually sends a message all the way down, all the way up to C4 and back up, okay? And let's say someone has a misalignment at C1, C2, C3, C4. Well, if they have brainstem compression, this actually could cause facial pain up here. So everybody thinks I have pain here. This is where the problem's got to be. That's not true. The problem could be here. And when we take pressure off of here, it can relieve pain here. Can I get are people understanding that? Like there's a connection there if that's the person's problem, okay? Or they can have a problem anywhere in the neck, because this is where the nerve starts here, and it can go this way, and it also comes up, down, and around into the face, if you're seeing my picture here. So again, remember, brainstem's between the ear. It's going to come down all the way up down to C4, which is about here, and then it's going to wrap back up into one of these 3 branches. And if there's any compression and it can't get there, it can cause sensory pain or trigeminal neuralgia, okay? That's one example. The next one, so post upper cervical corrections, the lower cervical vertebrae return to their natural alignment. Stress is relieved from the lower cervical vertebra and the corresponding neurology. And this affects pain pathways into the brain where the pain's interrupted. There's also blood pressure, okay? Because some people say that's why we do microvascular decompression, is to, lower the, a predominant theory about causing the TN is the blood vessel is rubbing against the nerve surface. Well, NUCCA actually has a WebMD published study, and it was with back in 2007. It's the only chiropractic technique where this was proven to be accurate. Studies found that an atlas adjustment lowered blood pressure. Well, it wasn't any atlas adjustment. It was specifically a NUCCA atlas adjustment. Okay. It wasn't, if you went to your traditional chiropractic, and I'm not saying anything, I had to be a regular chiropractor before I specialized in the NUCCA work, because it did require quite an extensive additional training, just like our neurologists that we speak to on the calls as well. So with this NUCCA adjustment, they found that it lowers blood pressure. So if we had a blood pressure issue, this could lower it and take pressure off. The study was blinded with a placebo and a control. There was 50 patients in 2 groups. Half were given NUCCA adjustments and half weren't. And the reason why they could do that is because NUCCA is so gentle. There's no twisting, cracking, or popping, and it feels like as heavy as someone's taking your blood pressure. So it's very, very gentle. Like I said, we can take care of 3-day-year-olds to 90 or 100-year-olds. It doesn't matter. Or anybody who has rods or cages and all the nasty stuff that occurs in spines. They can still be treated with NUCCA because of how gentle and specific this is. Most of the time, they're very rarely we have to tell a case that they're not a candidate. But back to this, back to the blood pressure study, the most amount of force on a patient, I explained to you, was very gentle due to the leverage systems biomechanics and centers of gravity predetermined on X-ray. Not much force is required at all. And this is kind of an old stock picture, but this is what the adjustment would look like. Someone lays on their side, it's gentle pressure applied to the top of the neck. Post X-rays were taken on all the patients. Those given the actual, those given the actual adjustment showed a correction of the atlas, and the people on the post X-rays that weren't given a correction, they weren't. So this is Dr. Baccaris. He's in Chicago. He was the one that worked with this study from Rush Medical College, and compared to the sham-treated patients, those who got real procedures saw an average of 14 millimeters greater drop in systolic blood pressure, and the average was 8 greater on diastolic. So I'll have people that come into my office that read about this study, because it was really hot in 2008. It was on like Good Morning America. It was really big. And they'll just come in and say, hey, I heard you help blood pressure naturally. I don't want to take these pills anymore. And we'll take care of them. And we will watch their blood pressure drop on an average over an 8-week period of time. Now, it's not everybody. I want to make that really clear, but it's in the 70-some percentile of people that we've been able to help to lower their blood pressure naturally. And this procedure had effect on not just 1, but 2 blood pressure medications given. And this was Dr. Baccaris, MD. He goes, when the statistician brought me the data, I actually didn't believe it. He said it was too good to be true. I didn't believe it at all. And we had to check everything. And there it was. The reduction in hypertension leads to decrease in the constant diameter of the blood vessels. More space is created in the area around the blood vessels once there's no longer engorgement, and the nerve has less likely to be able to be contacted by the offended blood vessel. I'm going to make another comment about the blood pressure. I lost my train of thought on that. But the blood pressure can be very, very powerful just in general for overall health. And the way this happened was Dr. Dick Holtz was a NUCCA chiropractor, like, leave up the road or something. They were in the same neighborhood. And Dr. Baccaris was this on staff at Rush Medical College and was a cardiologist. And he kept having these patients come in and their blood pressure kept getting lower, and he wasn't doing anything. He was taking people off their blood pressure medication. He goes, what is going on? And he went through all of his patients' charts, and he found out they were all seeing this NUCCA chiropractor. And that's actually how this study came about. So I thought that was pretty cool. So brainstem compression and muscular contraction. So this is the other theory. When the atlas bone misaligns, it can cause compression on the brainstem area, like we talked about. And due to the dural or soft tissue attachments, not bony compressions, the end result's the same, and the integrity of the brainstem is affected. And we already talked about how important the brainstem is, because that's where the trigeminal nerves originates from. So the brainstem is home to many nuclei, and nuclei means the origin of a nerve, and this area controls the nerves. That's a very specific diagram there. And then when this again is a pre and post adjustment picture, but when there's brainstem compression, you're going to have the atlas is displaced. There's going to be a leg inequality. And then afterwards, when it's aligned, things should equal out. Shoulders should equal, hips should equal, legs should equal. With compression, we have contraction and spasticity of many of the muscle groups. The tightening of these muscles in the neck and face regions may affect the trigeminal nerve as well. So those are the theories of why. And the biggest thing is everybody, if we really want to help our bodies, we want to find out really what the root cause is, right? Like, we know we're not having trigeminal neuralgia because we're deficient in Tegretol. Like, that's not a thing, right? Like, that's just an example. And I understand why it's there, because having that debilitating pain, I would do anything I could to get rid of it as well. But I want to offer another option for people. And this is just an example. This is kind of a little bit older, and my presentation hasn't been updated, but I have so many wonderful people that we have helped with trigeminal neuralgia. Now, this one was referred by his medical doctor to our office. He had the trigeminal neuralgia. And let's see here. I'm kind of going to skim it over. He said his pain was at a level 20, and he prescribed oxycodone, 800 milligrams of Tegretol. He was worried about the prescription medications, potential damage to his liver. But then he found about NUCCA, and about 3 months after care, he went from taking 800 milligrams of Tegretol to about 200. And that was 3 months. And after 8 months, he no longer needed his medication. It took him some time for his body to heal, but he got into a really great spot. So he was really excited about that. And he was an electrician, or he is an electrician. So it was a lot of overhead lifting and a lot of things that are going to affect the head and neck. And that does slow your healing down a little bit too. This is one of Joan. She had heard me on my radio show, your Weekly Checkup, and she suffered with trigeminal neuralgia as well. And she had it for about 2 years, and she had oral gum surgery. She was taking medications, and she found great relief with it as well. And she loves that she's able to have, more pain-free days and feeling like herself again. This is an interesting case. This is Deli. She had the microvascular decompression surgery. She suffered with this pain for some time, and she said she had it for 10 years. She tried other treatments like the MVD, which is microvascular. She also tried Tegretol. And then she started coming in, and now she goes, life is much better without Tegretol. I didn't realize after 10 years of using the medication how it actually affected me. I'm awake now, and she can go back to activities that she wanted to do. And I actually just saw her, I think last week or 2 weeks ago, and she just does really good. And she comes in, and we do regularly check her now, like once a month, and she holds really well, and she does wonderful. So she's very, very happy and able to enjoy her grandkids. So those are just some examples, and I have lots and lots more cases of people. I actually had a lady in yesterday. She drives 2 hours to come see us. She wanted to be on the group today, and she had a prior engagement that she wasn't going to be on. And she said that she was really wanting to be on here, and she's doing just fantastic as well. And I think she heard about me through this group, Tim. So what else does Upper Cervical Chiropractic Care help with? Upper Cervical helps with the entire spine. It's a gentle, there's no force. Most pressure a patient receives is, like I said, like a pulse. And because of the fact that, and even the fact that people have had hardware or surgery, they can still be candidates. So these are some examples of things that it helps with. Believe it or not, allergies, asthma, arthritis, carpal tunnel, chronic ear infections. That's a big one. I can't tell you how amazing that is with ear infections. And oftentimes when people have the trigeminal neuralgia, they may also have eyes or additional occipital pain or ear fullness or dizziness, because that area is all connected in the face there. Vertigo, disc disorders, seizures, fibromyalgia, headaches, migraine, cluster headaches, insomnia, irritable bowel, menstrual, multiple sclerosis, obviously neck, back, arms, legs, and joint, thyroid, and TMJ disorders. Now, the reason I put these all up here is because what I said in the beginning of the program is that when the brain and body aren't communicating correctly and there's a kink in the hose somewhere, and we restore that, health restores. So we don't claim to cure any of these things. We claim to put your body into alignment for your body can express health optimally. And when we do that, a lot of these things get better. Does that make sense? So these are some websites of interest. So the first one, I know I saw there was a woman on from New York earlier, and maybe someone on from Florida today. If you are looking for a NUCCA chiropractor and you are not from the Metro Detroit area. And again, I do have people that travel in quite ways, and we do try to get them connected to a chiropractor in their area because that's where they're going to best be served. and is you can go to NUCCA.org, NUCCA.org, and you can put in your zip code and you can find out who's around you. And I would recommend going in for a consultation and seeing if it's a fit for you. And that's where we always start too. Like, we need to discover if we are going to be the right fit. And we'll let you know on day one if we think we can help you or not. Now, the second website is my website. And that's our NUCCAinfo.com. And that's the Troy office. And then we have some additional upper cervical websites on there. Now, the blood pressure website, or the blood pressure, was not effective with these other two techniques. But there are other good sister techniques if you're in a very, very low population area and you need to try to get some relief. Okay. I'm going to move on. And then this is some information about my office. I have our phone number on there and our website. So I'd recommend getting connected with us that way. I'm going to put that back up there. And that pretty much summarizes our talk tonight. But a couple things that I hope that you guys got out of this is I hope that you learned a little bit more about the anatomy of the trigeminal nerve. I hope you learned a little bit more about NUCCA chiropractic and another option or avenue for you. And I hope that if you're interested, that you take action on one of those websites and set up a consultation to see if this is something that would benefit you.
It's great. Thank you.
Fantastic, Dr. Cramer. I wanted to ask you about the two new doctors you have now in your practice, because my friend, I emailed you. I don't know if you had a chance to.
I did. I'm sorry I did not respond to that. So,
no problem. Yeah, but Jan, my best friend, went to see Dr. Cramer the other day, and actually she's been going a couple of weeks now. She was having some back issues, and she was able to see Dr. Peter Fox, and he just massaged her neck very gently after doing some x-rays, and he showed her exactly where she was out of alignment. And just that gentle massage made all the difference in the world. And she's a teacher. She's up and down a lot. And she was just really, really happy with your service, and that relieved that there was no clicking and popping and cracking and all that. So she's
thank you so much, Lynn. I do work with other chiropractors. Dr. Hanselman's been with me 6 years tomorrow. So he's definitely not new with us. And Dr. Fox has been with us 4 years. So
already 4 years.
Yeah,
where does the time go?
I work with many other chiropractors in the office, and I'm actually looking for a third doctor to hire to bring in. So there'd be 4 of us in the office, because we have a lot of people we're helping. And I'm so sorry I didn't stop sharing my screen. I can do that.
Well, I remember when you just started out, you had that extra room with the blankets and the videos you could watch.
So different. So different now. But what I was going to say is, so they've been with me again 6 years and 4 years. They're great chiropractors. I actually have people that'll come in and train with me to learn NUCCA. I had a lady from California, from New York. I have people come in all the time because I'm a training center as well. And we give really great care, and they're the ones. I need someone to take care of me. Come on.
Isn't that the truth?
Yeah. So it isn't just me in the office. We have, like I said, 2 other wonderful, just wonderful, like Lynn said, chiropractors. And we actually do grand rounds every week. We go over cases. It's like, that's awesome. People are getting really, really outstanding care in our office. And I know it's my office, but we put a lot of love into it because we have a lot of passion for it.
Absolutely. Thank you so much.
Oh, yeah, you're welcome. Did anybody have a quick question? I just have a couple minutes before my children are going to be home and I'm going to have to skedaddle tonight.
We have a question from Katie. Doctor, can you describe what the first few visits might look like for a TN patient? And while there are differences between patients, what is a typical time frame that one might expect for addressing TN symptoms?
Oh, those are great questions. So initial visit in our office is, you fill out some new patient paperwork, you come in, we sit, face to face, and we go through a thorough health history and find out what's everything that's going on. Then we do a chiropractic measurement to find out if you are out of alignment. And if you are, then we take 3 specialized digital x-rays of the head. So we get a 3-dimensional view. And we also do an EMG scan of your entire spine. Then we actually end that visit, because then I take that information and we have to study it. We have to figure out exactly how you're misaligned. And you could be misaligned one of 10,000 combinations, 5,000 from the right or 5,000 from the left. So there's a lot of work involved from that visit to the first adjustment. Then when the first adjustment occurs, we get you adjusted. We actually take a post x-ray and find out how well we did and if there's anything we can do to make it better before you leave that day. And then we're all done with x-ray unless something warranted, like a new accident, injury, or something like that. And then we actually go over a bunch of do's and don'ts and what to expect on that visit. The third visit in our office, we actually do a follow-up, find out how well you held the adjustment. We measure your alignment, see how well you held. We go over some symptom changes. And we outline a care plan for you of how we think we're going to get you up that road to recovery to heal. And we actually show you your x-rays that day too. So we have a very thorough, in-depth 3-day kind of process in our office. Now, someone with trigeminal neuralgia, we typically see them twice a week. And that can be anywhere from 4 to 6 weeks in the beginning, depending on the type of case that is. And then we do a reevaluation to figure out what you're going to need next.
Great. Great. Do you pick up your email at home, doctor?
Sometimes.
Could I send you one later after the meeting?
Yeah, you can send me one. That'd be great.
I just need to chat with you on the side on an issue.
Okay, sounds good.
It's quite severe.
Yeah, okay,
Thank
absolutely. You. But really what's great is, because this is recorded tonight, I know we're going to connect with other people that aren't here, and using that website. I mean, the interesting thing about, a surgery is you can always have it done, but you can never undo it. So if you're on the fence of what to do, my best recommendation is do least invasive to most invasive. That's how I would vet this process if it was my health. And if people are on the fence, I want to encourage you to do it that way. So,
yeah, Pete gets the video up pretty quickly usually too. So you might be I know there's a fellow up in Midland, had never heard of NUCCA, and he wanted to hear about it as quick as he could.
There's actually a NUCCA doctor in Midland, by the way, John Kowalczyk.
Oh, there is. Oh,
so we'll get him connected to John. Okay, I know him personally. He's a great chiropractor. Okay.
Yes.
Well, I enjoyed my time. Does anybody have any last other maybe question or two? I got maybe like a minute.
How many kids now?
Oh, two.
Okay.
Yes. There's a church event going on, so they're heading home from that right now. I got that. So I have a quiet house, so I'm going to skedaddle then.
Yeah, you could actually go to the bathroom before they get home. Wouldn't that be something?
That'd be great. Well, you guys enjoy your meeting. Thanks for having me on, and I wish you guys all the best on your journey for your health.
Thank you, Dr. Cramer.
Okay, bye-bye.
Bye.
Okay, now we can enjoy fellowship question and answer. Just again, the reminder that we're recording. We can turn it off at any time.
Hi, Katie.
Maddie, nice to see you.
Hey, how is everybody tonight?
Very good.
Doing well.
Good.
I thought that was very valuable input.
Yeah, she takes a lot into her day.
Yeah. Some people have had success and others haven't with the NUCCA process or procedure.
I'm curious how many you've seen over the years follow that route and have good outcome.
Yeah.
From our group, we've had quite a few originally that had seen her. We had a couple that they both had TN, husband and wife, and they had really good success. And they saw her until they passed, and they were elderly, but they saw her once or twice a week until they passed.
Yeah, John Parkinson.
Yeah, actually, John's still with us. His wife is on. You're right. Yeah, they were really benefit from it. I did go see Dr. Cramer and went for quite a while. I just could never hold the adjustment, and I don't know really why. I guess I've got some spondylolisthesis that kind of my spine is stacked oddly on top of each other. So it didn't help in the adjustments, but she's fabulous. And I love all the scientific instruments that she has there. You'll really be impressed when you see her office. Everything is measured, and you feel very confident that she's knows what she's doing and gets good results. And it's nice to see NUCCA is taken off around the country too. It's not that cracking that, people have had before that is pretty scary sometimes. Mm-hmm. Yeah. Has anybody tried NUCCA? Yeah. Tim, you went to see Dr. Cramer, didn't you?
No, I never did. I probably should have now.
Yeah.
Well, that's what I've got going on, but
yeah.
It wasn't specific to TN. That's why.
Sure.
I wouldn't waste people's time.
Sure.
I thought when I was looking at the video or pictures of it, I just searched it on my phone, as all the patients are lying on their side. And I thought, oh my God, I just can never lie on that side of my face. And it made me panic right away, thinking about any pressure that would have been applied to either side of the face, really, for me.
So both sides of your face hurt, huh?
No, just the one side. But, the video that I was watching, there's a lot of touching of the face, like a hand is planted there and then one on the shoulder. And I thought, I'm so fearful of anybody getting that close to my face.
Sure. That's understandable.
Yeah, for sure. But,
Yeah.
I see an upper cervical chiropractor here. And I don't always hold the adjustment very well either. But I'm pretty regular with every 2 weeks. Like, not much gets in my way of my chiropractor appointment.
Oh, good for you. Who do you see, if you don't mind me asking?
Dr. Brian.
Okay.
I know Aaron was a patient of his. In fact, we had a meeting at Beaumont. I don't think you were there, Lynn and Pete. And there were just very few of us. Tim was there, I was there, my husband was there, Aaron was there, and maybe another woman. And all of us were seeing the same chiropractor, Dr. Brian, at 25 in Shelby.
Yeah.
Wow. That's good to know.
Yeah.
Did we videotape that?
It's still rolling. I can turn it off anytime.
No. I wondered if we videotaped the meeting she was talking about.
Oh,
Was that before we videotaped?
you got to ask Aaron on that one. That's pre-Pete.
I really don't remember. It might have been our last meeting before the pandemic.
Oh, okay. Yeah, my memory is, as I push 80, is lacking. I need to lean on Lynn many times.
Yeah, we all do.
Does your face throb when you lay flat?
No.
No. Okay. Yeah. Initially, that's the trouble I had. Anyway. Anything else, Lynn?
Nope, I can't think of anything. Does anybody have any questions or concerns you want to talk about?
No.
Thank you, all of you.
Okay.
Thank you.
It's good to see everybody.
Yeah.
Thank you so much. It was a great talk.
Thank
Okay.
you for coming.
Thanks, everybody.
Appreciate it.
Thank you.
Thank you so much.
Care.
Yeah.
Bye-bye.
Glad
Bye.
you could make it.
Bye.
Night.
Take
Night.
care. Bye.
See you, Aaron.
Did you stop the recording, honey?
I will stop it right